This is the right knee joint and this one is left knee joint. I am standing on the right side of the cadaver, and this knee joint is a complex variety of hinge joint, because here not only one articular surface, there is articular surface articulation in between the femoral condyle and the tibial condyle, and another one from the patella to the femoral condyle. This is patellofemoral joint and this is femorotibial joint. That's why it is known as complex or compound variety of hinge joint. Now coming to ligaments of the knee joint. They are intracapsular and the extracapsular. Extracapsular, that is outside the capsule of the knee joint. This here we can see, this one is ligamentum patelli, which starts from the lower part of the inner surface of patella. There here we can see this one is patella. From the lower part it starts and going to the tibial tuberosity, upper smooth part. Here we can see the distal attachment. This is ligamentum patelli. This is one of the extra-articular ligament of the knee joint. Another one, in this right knee joint, it is quite visible. Here, this one is the tibial collateral ligament. This one is tibial collateral ligament or medial collateral ligament, which is attached to the medial epicondyle of femur and going to the upper part of the medial surface of tibia. This is tibial collateral ligament. It is supposed to be the lower degenerated part of the adductor magnus muscle, and it is very worth mentioning that this one is superficial lamina, and there is also deeper lamina of the tibial collateral ligament, which is going back side, and here posteriorly where my finger is, this is the deeper lamina. Here what we can see, this is the tibial collateral ligament, and this part is the superficial lamina only, and the deeper lamina is going behind where my finger is. यहाँ पे दिखा सकते हैं, where my finger is, this is the deeper lamina. Deeper lamina is attached to the joint capsule. This is the deeper lamina, and in between these two there is, this one is semimembranosus muscle. This, in between these two lamina, this muscle is दिखाई दे रहा है, semimembranosus muscle, which is passing in between the superficial and deep lamina. This thick muscle, okay, and along with this, the medial genicular vessels and nerve are going. Now, coming here, this what we are seeing is the, from here to here is the fibular collateral ligament or lateral collateral ligament, which starts from the lateral epicondyle of humerus and going up to the head of fibula. This one, okay, fibular collateral ligament, and posteriorly oblique popliteal ligament. It is penetrated by, here you can see the vessels are going black. These are the vessels. This is medial genicular vessel, which pierces, this one is the medial genicular vessel, which pierces the oblique popliteal ligament. This one is oblique popliteal ligament on the posterior aspect of the knee joint. Okay, this is also one of the extra-articular knee joint, extra-articular ligament of the knee joint. Now coming to articular surface. This one is the articular surface of femoral condyle, and this is of tibial condyle. Now I am flexing the knee joint, and here articular surface of tibial condyle. This one is medial meniscus, and here is the lateral meniscus. M for medial meniscus and M for mega. Medial meniscus is larger in size, whereas the lateral meniscus is shorter in size. These are two intra-articular ligament of the knee joint. In between the articular surface of the tibial condyle and the medial meniscus, here you can see the sparse fiber of coronary ligament all over, anteriorly, medially and posteriorly of the medial meniscus. But here the coronary ligament, which is in between the lateral meniscus and lateral tibial condyle, it is only present on the anterior aspect. The reason why medial meniscus is more fixed, because coronary ligament all over, and also the tibial collateral ligament, this one, tibial collateral ligament is attached to the deeper lamina is attached to the medial meniscus posteriorly. Why? The medial meniscus is fixed and more prone to be injured. Okay? And here we can see this is the anterior and posterior cruciate ligament. This one is anterior. The name is according to its position over the tibial condyle. So this one is anterior cruciate ligament, and posteriorly there is posterior cruciate ligament. These are the intra-articular ligaments of the knee joint. And these are the few parts of here we can see these are the few parts of the meniscofemoral ligament. These are the meniscofemoral ligament which starts from the anterior horn of the lateral meniscus and going to the posterior cruciate ligament. Anteriorly there is anterior meniscofemoral, posterior to the posterior cruciate ligament is the posterior meniscofemoral ligament. These are all intra-articular ligament of the knee joint. Thank you.